Welcome everybody to night 2 of the CMREN Substance Use Disorder educational event titled Prevent, Treat, Recover, an Interprofessional Approach to Substance Use Disorder. We're so happy to see you back if this is your second night with us. And if you were unable to make it last night, thank you so much for joining us today. In this Zoom link, we will have 2 sessions tonight, with the first one being Substance Use Disorder is not a one-size-fits-all. And the second one being addiction is a family disease. So for our session right now, it's a deep dive into harm reduction, syringe service programs, and the most recent data that we have to support our discussion and what you can do to best serve your community. Our presenter tonight is Shelby Posh, Health Promotion Supervisor with Central Michigan District Health Department. Shelby oversees the Syringe Service Program, Sexual Health Clinic, and Hepatitis C Linkage to Care Program. Her background is in substance use prevention and health education at the local community level. And please join me tonight in welcoming Shelby to be our presenter.
Well, welcome guys. So if you were in last night's session, I was a panelist there, so I helped to give a little bit of insight on harm reduction. And so that's kind of what we're going to talk about tonight. I'm going to go into harm reduction, what it is, and what a syringe service program is. So we'll talk about the history, how it's a harm reduction approach, the benefits of it, and then I will go into our syringe service program that we have here at Central Michigan District Health Department, which is called Exchange Central. So we're going to dive right in. Typically, this is an hour-long presentation. So hopefully I can get through it in time and have a lot of leftover time for question and answer. So if you have questions, I believe you just put them in the chat box and then we can address them afterwards. But also all my information will be available at the very end. So I definitely encourage you to jot that down and you can reach out to me at any time. So I really like this graphic. It really highlights harm reduction in a way that we can all relate. So it says we should ban life jackets and other flotation devices. They only encourage risky behavior. The only 100% effective way to prevent drowning is total abstinence from going in the water. So how can we continue to engage in this risky behavior while also still be as safe as possible? That in a nutshell is harm reduction. So with harm reduction, when it comes to IV drug use and substance use, it's us being able to accept that this is happening. This is a lifestyle. This is within our community. It is with our loved ones. So how can we take that lifestyle and just make it as safe as possible? And that's what I love so much about harm reduction is that we can accept the person for where they are and let's do everything we can to make them as safe as possible. Harm Reduction Coalition highlights this very well. They say harm reduction is a set of practical strategies that reduce negative consequences of drug use, incorporating a spectrum of strategies from safer use to managed use to abstinence. Harm reduction strategies meet drug users where they are at, addressing conditions of use along with the use itself. So again, it's not that prevention piece where we're trying to prevent these things from happening. It's already happening. We know that. So how can we accept that and move forward with getting people the help that they need and to get them as safe as possible? So the traditional substance use strategy, this kind of shows how on the spectrum, we have prevention on one side, we have our active use, and then we have recovery or abstinence at the other end. It's kind of that black and white, cut and dry picture of how traditional substance use strategies and how they're addressed. Well, we know that that is not how substance use works. That is not how recovery works. So to look at it as a harm reduction approach, we're looking at the full spectrum. So this is a harm reduction model. We have prevention on one side, we have relapse and recovery on one end, and then we have our active substance use in the middle. So harm reduction, again, meets people where they're at. It understands that there are multiple pathways to recovery, that it's not a one size fits all. Relapse is a part of recovery. On average, it takes a person about 6 tries going into treatment for it to actually work, for it to actually stick. And there are several different treatment options. Some people choose abstinence. Some people choose medically assisted treatment. So even that is a full spectrum in itself. So harm reduction, again, just is that full sway from prevention to relapse to recovery. And it goes back and forth and back and forth. and we are in the midst of it. We are in it with that individual in helping them to get everything that they need during that time. It's not to say that we're not there when they are ready for treatment, because we are and we have those resources. But it's being in the moment with them and say, hey, it's okay. This is a part of your lifestyle. You're choosing to do this. Let's do it the right way. Let's make it safe for you. So this picture really hits hard for a lot of people, and usually I warn people that it's coming up, because it can be pretty effective. So it shows a brand new syringe, a brand new needle, and then we have our needle after it's used once, after it's used twice, and then after it's used 6 times. So not only are we looking at using a clean syringe to help decrease the spread of infectious diseases such as HIV and hepatitis C, but also for vein care. Think about after using it one time, after using it twice, and then 6 times, being that sixth person, what it's doing to your vein. So this picture it hits my heart really really heavy, because I can't imagine having that being stuck into someone's body. And I'm going to reference this later on when I'm throwing out some statistics on how syringe service programs even came about, how they even became a thing. Because having a clean syringe is so important for the decrease of spreading infectious diseases, but also for our bodies and for our vein care as well. So, what is a syringe service program? So, I highlighted kind of harm reduction, what it is, and how syringe service programs fall into that harm reduction field. So, syringe service programs they've been around for a while. They've been in existence since the late 1980s. When they first started, they were more known as syringe exchange program or needle exchange program. So, you're going to kind of hear these terms interchangeably. I just naturally say SSP, syringe service program, so that's what you're going to hear me reference the most. But when they started off as syringe exchange programs or needle exchange programs, and it had a great, great concept behind it. So what it was basically it was a one-to-one exchange. You brought in a syringe, you got a syringe. So they encouraged people to bring in their used syringes in order to obtain clean ones, which is great. It's environmentally friendly. That's what we want. But also, why are we going to limit someone for getting a clean syringe if they're not able to bring their dirty ones in? So we kind of have evolved from the exchange approach to being a program or an access site in itself. We also now have the research and the scientific evidence to prove that people are cognitively environmentally safe. So they are disposing of their needles properly. So it was one thing that we learned, that it's not really necessarily a need to be that site for a needle distribution. So that people that we're using, they actually are disposing of them properly. They're doing what they need to do. So we encourage people to bring in their used syringes to us when they come in to get supplies, but we're not going to turn them away if they don't. It's okay. So back to kind of how they became in existence, they have been scientifically proven to reduce the transmission of HIV, hepatitis B and C, and other blood-borne pathogens in people who inject. I do want to put the disclaimer out there that syringe service programs are legal. So, per the Michigan Public Health Act 368 of 1978, Section 7457, if you want to read the whole thing, go for it. It's super long and very confusing to my non legal term brain. So, I just, in a nutshell, put what we need to know for tonight. But it basically states that the distribution of injection supplies or any drug paraphernalia, as we would refer to it as, by any state or local governmental agency or by a person authorized by a governmental agency to prevent the transmission of infectious agents is legal. Federal funds can now be used to support SSPs. And I say support because federal funding that we receive to operate a syringe service program is that in itself. It supports syringe service programs, but it cannot fund a syringe service program in itself. And I will go into a little bit more of that, into more of the detail on that a little later. But just know that they are legal and we are operating safely within the community. So this is a really cool infographic that I like to keep on here. I haven't received the most up-to-date one, but it goes to just show that certain service programs and what they're doing has definitely had a big impact. So a study of Connecticut police officers found that needle stick injuries were reduced by 2/3 after implementing SSPs. After the implementation of an SSP in Portland, Oregon, research demonstrated a nearly 66% decrease in the number of improperly discarded syringes. New HIV infections have declined by 80% among persons who inject drugs since the implementation of SSP in the late 1980s. Testing linked hepatitis C treatment can save an estimated 320,000 lives, and SSP clients are 5 times more likely to enter into drug treatment programs versus non clients. So I talk about how important it is to have that clean syringe, but also so much more it comes from operating a syringe service program, not only for the individual, but for the community itself. I know our police officers have definitely, they have talked to us about needle stick injuries, and they do feel more confident when they're searching vehicles, when they know that we have sharps containers available for the public, that people can get them anytime they need them. And then also that we can link people into treatment. That is an option. We have a full book of resources, not only for SUD treatment, but also mental health. If people need, transportation, if they need housing, propane, anything like that, groceries, stuff like that, we have connections through our SSP program that we can help link those people into the services that they need. Most importantly, syringe service programs have not been shown to be associated with increase in drug use. So think about it. If you have a syringe service program within your community, you're not going to see an influx of IV drug use within your community. It's not like someone's like, oh, I have a syringe service program in my neighborhood. I think I'm going to start injecting. That's not the concept. So just know that we have not seen an increase in drug use whatsoever after implementing an SSP. So that's not associated. We were afraid to have that kickback when we first started to approach legislature about getting an SSP program through the local health department. And this question was posed, but we have evidence, we have the data to prove that just because you have an operating SSP within your community, within your jurisdiction, it's not going to increase drug use. So the opioid epidemic by the numbers, this is from 2018. So we have some of the numbers shown here. So since 2000, opioid overdose deaths have grown tenfold in Michigan. This epidemic impacts thousands of Michiganders and their families, friends, and communities. It's one of the greatest public health crises of our lifetime, and we must respond urgently. Someone spoke on a COVID call that I was recently on in regard to harm reduction, and they made a great statement. They said, we are in an epidemic within an epidemic. This is not stopping just because we are facing another epidemic. We're still in it, we're still living in it, it's still happening. So our services have never stopped because we are in an epidemic, because our doors have been locked at the health department does not mean our syringe service program has stopped. I know a lot of other syringe service programs have been creative within the state, offering mail based systems, offering mailing naloxone, even. So we have been getting creative, but know that we are still operating during this time. So in 2018, there were almost 2,600 deaths from drug overdoses, which were more than car crashes in Michigan, which used to be the leading cause of death in Michigan. There are over 2,000 deaths from opioid overdoses, over 1,500 deaths from synthetic narcotic overdoses, including fentanyl, and 639 deaths from heroin overdoses. And I want to put a plug in here when I speak to opioids, heroin, including fentanyl, that those substances are affected by using Narcan or naloxone. So Narcan and naloxone, I'll use those interchangeably as well, but it's the opioid reversal medication that is used to help reverse an overdose if it's happening. So having that on someone or having that on you in case a situation happens, that will potentially save a life. And we always encourage through our trainings to always call 911 and things like that. But um, Narcan and naloxone can save lives, and we have seen that. And that is one of the biggest pushes in our program. And I think the most success that we're having within our program is overdose training and prevention by distributing naloxone. So overdose rates in Michigan, this just kind of highlights, I did highlight our jurisdiction because I use this through the health department. But you can see that SSPs have reduced overdose deaths by teaching people who inject drugs how to prevent and respond to drug overdoses by learning to use naloxone, which is the medication, again, to reverse an opioid overdose. So in 2018, the age adjusted rate of drug overdose deaths in the United States was 4.6% lower than the rate in 2017. In 2018, there were 67,367 drug overdose deaths in the United States, which is 4.1 fewer percent than in 2017. The age adjusted rate for drug overdose deaths increased by 6.1 per 100,000 standard population in 1999 to 21.7 in 2017. The rate has increased on average by 10% per year from 1999 through 2006, by 2% per year from 2006 through 2013, and by 14% per year from 2013 to 2016. So we can kind of see how each year the rates were higher. And also we have data to show that rates were higher each year for males than females. And there was a continuous increase for males versus females over the time span as well. So now I'm going to talk a little bit about the history of syringe service programs and how they came about and why they are a thing. So it all started with an HIV outbreak in Scott County, Indiana. So in January of 2015, 11 HIV cases were confirmed. These residents were all of the same community and they were all linked to syringe sharing partners. So then in March of 2015, a public health state of emergency was declared. And then in April, the Indiana State Department of Health had diagnosed 135 people with HIV. That is a lot. We know that HIV is around. We operate and test HIV within our own clinic, and it does happen. But this would be absolutely insane to have come through in such a short span. So you can imagine the state of emergency that they declared and why they declared that. So of those 135 people that tested positive for HIV, they ranged from 18 to 57 years old. Over half of them were male. A small percentage of them were infected pregnant women. 108 of them reported IV drug use, and 114, or 84.5%, were also co-infected for hepatitis C. So I kind of want to focus a little bit on those last two statistics to kind of share what those kind of mean. So we had 135 people that had HIV. 108 of them reported IV drug use. Now, so you can contract HIV other than through blood. HIV is contracted through 5 bodily fluids, blood being the main one. So sharing of syringes is a mode of transmission, but also it can be transmitted through sexual contact, through anal secretions, vaginal fluid, semen, and then also through breast milk. So it's alarming that we had infected pregnant women in this situation, because mama can pass it to baby either from blood to blood through pregnancy, through the birthing process, and then also through feeding baby to breast through breast milk. So that raises a big alarming question. And then also being co-infected for hepatitis C, we are seeing very alarming rates of hepatitis C in our younger population, in that 25 to 35 age range. It's not something that we've ever seen in history before. Mostly it was with our baby boomer population, and that was due to blood transfusions because they didn't test for hepatitis C then. Now we do. So now it was alarming that we're seeing this in our younger population. So now we know that we can link it to IV drug use. So of those original 135 people who were interviewed, reported on average of 9 syringe sharing partners, sex partners, or other social contacts that might be at risk. So think back to that graphic that I showed in the very beginning of that used syringe after one time, after two times, and after six times. Imagine what that syringe will look like 9 times after being used 9 times. So you can imagine the damage it's doing to someone's body. 373 possible exposure contacts were made of these 135 people. 247 of them have been located, and 230 of them were actually able to be tested. Of those 230 contacts that were tested for HIV, 109 of them, almost 50%, were positive. So we do a thing that's called partner services through the health department. And what that is we investigate all positive HIV and syphilis cases within the state. And this is a very vital program to help to reduce and stop the spread of these infectious diseases. And that's exactly what they did with this outbreak in Scott County, Indiana. They took that population that originally tested positive. They interviewed them. They got their current and past sex and needle sharing partner history. They contacted those people. They located them. They tested them. Then they get their contacts, and it just keeps going and going and going in the hopes of stopping and preventing the spread of HIV and hepatitis C. And within our health department, we also do that with syphilis as well. Physician Cook of Indiana, who treated many people in this HIV outbreak, stated, "If we already know what communities are at risk, why aren't we doing more? There's more than HIV at stake. There's infective skin diseases associated with reusing syringes. There's overdose deaths. There's hepatitis B and C and lots of other things. The focus shouldn't be on the next HIV outbreak, but helping people at risk not to get sick and die as much. We can do without fancy tests in the lab. It's great for tracking things, but we have real people dying." And this is the truth. This is a real eye opener, and I am so glad that we have been able to evolve, but we have so much more work to do. The CDC did a study to predict county level vulnerability for rapid dissemination of HIV and hepatitis C among persons who inject drugs. So basically, that's saying they looked at the opioid epidemic. They looked at those high risk counties that have a high influx of opioid use, of overdoses. They took that and they predicted where there could be a potential risk for another HIV outbreak. So looking at Michigan, the study that the CDC conducted, it identified 220 other counties within the United States that were high risk. Of those 220, 10 were in Michigan, and two of those 10 were within our jurisdiction for Central Michigan District Health Department, which are Clare and Roscommon counties. With this identified, a need was determined that a syringe service program is a must within the communities in which we serve. Some history behind syringe service programs, and the biggest barrier is funding. So in 1988, the fundings that were provided to even begin to have a syringe service program basically said that you cannot use federal funding to purchase any syringes or needles for illegal drug use. It was prohibited under this act. So it put up a big wall on how we could implement these prevention measures to prevent another outbreak from happening. So fast forward, the ban was temporarily lifted, and currently the ban is partially lifted, which means it allows federal funds to operate syringe service programs, but we are not able to use our grant funding that we receive to purchase syringes or the cookers for our program. So the cookers, I'll have a picture of what we offer at the very end here. But those are what you put your substance in, to put the water in and dissolve it to draw it up within the syringe. So those two things were identified that we cannot purchase. So we have to get creative in how we're able to get those supplies for our program. But we are able to use federal dollars for other things, such as our sharps containers. We have a partnership to get our nasal naloxone. So we are able to purchase a lot of things. We also can do guest cards, and we can travel to meet people where they're at. So we can do a lot with the federal funding that we have received. The history shows that Michigan is gaining support We've already discussed the CDC's vulnerability study, which determined the need for a state. And this is a snapshot of the letter of support from the governor's Prescription Drug and Opioid Abuse Commission that just continues supporting syringe service programs in the state of Michigan, pretty much, is all that's saying. So this shows a map of the expansions of SSPs in Michigan. This was taken for fiscal year 2019. So we have grown, and on some later slides, it'll show where we're at. So you can see all the blue areas of where we're operating syringe service programs. But I will put the disclaimer out there too that you can cross county lines. It's not like we're gonna, if you don't live in our county, we're not gonna serve you. There's nothing like that. This shows the area, but really we can serve anybody. MDHHS does a great job showing and highlighting syringe service programs and all the work that we are doing within the state. We're a pretty tight knit group. We meet monthly so we can bounce ideas off each other. We can talk about our barriers. We can share things that are going on. It's a very, very great partnership that we have. So if you go on their website, you will see these 6 boxes on there, and you can click them and it'll walk you through. So for school or anything like that, if you need the most up-to-date data or statistics, you can click on that box and it'll take you to it. If you want to find a syringe service program, oops, oh no, there we go. Find a syringe service program in your area, you click on that box and it's going to take you to this map. And this map is really cool. So then you would click on the syringe nearest to you and it'll link you right to that website. So in the Big Rapids, the Ferris state area, the closest one to you guys would be the Grand Rapids Red Project, which is in your area. They serve a huge population and they have a couple mobile units that also go out on certain days to more rural areas. So people with transportation issues can more easily access their services as well. This is a list of Michigan supported programs and it is growing all the time. So currently we have several that are supported at the local health department level, which includes us. And there are several that are also currently supported at the community level, like the Grand Rapids Red Project. And then there's one that is currently operating underground with no state or federal support, which is Harm Reduction Michigan. And I also encourage you to check these out. Everyone does things a little bit differently. And so we always are sharing ideas and we will refer across jurisdiction if one is doing something that meets the individual's needs a little bit better. And Harm Reduction Michigan has a really cool website. They do a lot of really neat stuff. They do a lot of advocacy in the community. So you can learn a lot about what's going on and how you can get involved through their coalition that they have. I talked a lot about the benefits of syringe services, but I didn't hit on the cost of them. So HIV treatment and hepatitis C treatment is very expensive. HIV and hepatitis C are both treatable, but HIV is not curable. So HIV treatment is lifelong. Once you have it, you're always going to have it. It is treatable. We have grown immensely in how we treat HIV. It is no longer a death sentence like it was in the 1980s when we first discovered it. But it is something that you will have to treat for the rest of your life. Hepatitis C treatment is a sticky situation, but we link a lot of people into care and it's getting a lot better. There used to be certain insurance stipulations where someone had to be in recovery, they had to be sober for so long before that they could get treatment. But now we're seeing a lot of providers have lifted some of those policies and we're able to seek treatment for a lot of people. But looking at those big numbers, and then you look at a sterile syringe, which only costs 6 cents. So you can imagine that economically how much this is going to benefit our community and our individuals who need it. This is just another really cool infographic that is on the state's website. They're always updating it and it gives some more statistics that are just a little bit non-traditional. So you can read through it. You can, again, check out their website. They have a lot of interesting stuff. It's kind of hard to read in such a small frame, so I won't go over it, but the website's at the bottom and you can check it out. There's just some really interesting statistics on this one. So now I want to talk about our program, Exchange Central. This is not a plug to our program, but I do want to share what we have going on. And I encourage you to talk about what we have going on, and what's going on in in your community, because you never know who it's going to benefit, who is going to learn from it, and who could even use it. So this is Exchange Central. This is our logo. We put this on pretty much everything so it's easily identifiable. We're trying to push it out a little bit more, and we're always getting creative with how we're sharing our information. This is just a snapshot of our page on our website. So if you just go to Central Michigan District Health Department and you click through the links for Health Promotion Division, you're going to come to our Exchange Central Syringe Service Program with all of our information and all of our dates and things like that. One thing that I pride ourselves on is how we offer a judgment-free location for residents from all of Michigan to receive clean syringes and works and dispose of used ones free of charge. What I like about us is that you could be coming to the health department for anything and nobody will know. You could be coming to us to get your COVID shot. You could be coming to us to get your flu shot, to get your well and septic permit, to get your birth control, to get STD tested. It really doesn't matter. You could walk through our doors for just about anything and no one's going to know that you're there for a syringe service program. We also have a ton of other resources available through our program, such as we have our free STD, HIV, and hepatitis C testing and linkage into care. We can help link you in to get your vaccinations. We have Narcan training. We have safe sex kits. We have family planning, which is your birth control, your physical exams, contraceptives. And then we can also help with the referrals into treatment, mental health, HIV, PrEP, partner services, insurance. If we can't do it for you, we know someone who can. So we've helped a lot of people. I know we just recently linked a hepatitis C positive individual into treatment that didn't even have insurance. So we were able to help navigate them and connect them to a person that they needed to get insurance so that they could get treatment for their hepatitis C. This is a picture of just some of the stuff that we have. We have much more, but this just shows like kind of what we put in our little quick kit. So you have your syringe there, you have gloves, your alcohol, prep pad, your ointment, Band-Aid, gauze, and then you have your filters. So the little cooker there, that's what's used to put your substance in. We also have sterile water that we give out in these little pouches so it fits your syringe perfectly. So you can put it in the cooker, dissolve it up, and then you put the filter on the end of your syringe in order to filter out your substances. One thing that we've been learning is that when people are using prescription medications, that they can be cut with some things that aren't easily dissolvable. So the filters really help to kind of filter that bad stuff out that is not going to be easily injected. We also have other things such as we have fentanyl test strips now, so people can test their substance. We have hygiene products, we have sharps containers, tourniquets. Like I keep saying, we have overdose kits, naloxone. We have rescue breathing masks to go with those. We have hand sanitizer. So we have kind of we're trying to be kind of that one-stop shop for pretty much anything that people may need. So how it works is it's pretty simple. We do a quick little intake. And when I say quick, I mean very quick, because a lot of times people, when they stop in, they don't want to be here long. So basically, the purpose of our intake is to get to know the person, to build that trust, to build that relationship, and to learn what their needs are so that we can best serve them. We create a very unique participant ID for them. And that's just so it's easier for us to look up what they've had in the past. So when they stop in, we can get their stuff around and so that they're ready to go. They can stop in, grab it, and go. We can take it out to them. We can meet them wherever they need to, but we know traditionally what they get so that we can make their encounters a lot quicker. The participant ID is very unique. When I say that, I mean, I don't even need to know your full name. So it's completely confidential and it is under lock and key at our office, the system that we use to report things. There's no name even linked to it. So nobody will ever even know that you're involved. On the card, we also have the paraphernalia law on there just in case someone has an incident. It is proof that they are covered under our program, that everything that we give them and everything that they have on them is legal. Now I say that, but we also explain to our participants that what we give you is legal. The syringes and everything are safe to have. But if you have substances on you, or as soon as you draw up substance in that syringe, we can no longer protect you. So we encourage people to let us meet them where it's closer for them, or if we need to come to their house and drop supplies off, we are willing to do seriously anything to meet them and make it as comfortable as possible for them. And we really want to just build that trust with our participants. And then every time they come in, we do an encounter. So we just jot down kind of what they take, what they didn't like. We get a lot of feedback from people. So we recently had feedback that our syringes are too long. Can you get shorter syringes? Absolutely. Let's look into seeing how we can do that for people. We've been told that our nasal naloxone isn't as strong as intramuscular Narcan. So that's something that I'm looking into, and having another source so that they can pick and choose what works best for them. So really getting that feedback from our participants is helping us a lot. And I also want to encourage people to do secondary exchange. So we have several people that will come in who will be picking up supplies maybe for themselves and everyone that they use with. They may be getting supplies for a loved one, for a family member. They may be getting Narcan because they know someone in their life that is actively using, and so they want to have that on them in case something happens. So we do encourage secondary exchange. So you don't have to come in just for yourself. You don't have to even be actively using to come and get these supplies. I have one individual who is my champion in one of my counties who comes in, and he is in recovery, and he comes and gets supplies for all of his friends who are still actively using because they are terrified to come to our office. They truly believe that there is a police officer outside our door that is going to arrest them when they get there. And we have heard this from several people. And it's something that it's just another barrier that slowly we're inching our way forward in building trust within our community. So he comes in and we load him up with everything that he needs, and he takes it out to where they are. And so we really encourage that secondary exchange. We also do secondary exchange with our police officers. I have an officer who investigates all overdoses in his county. And so we provide him with Narcan and all of our information. So he goes to the house of someone who recently overdosed. He interviews them and asks if they need anything, and then he takes Narcan with them so that they have Narcan available if it were to happen again. And we also help to supply Narcan for our road officers in our community, and we help supply it for our community city transit as well. So we do a lot of these trainings. We put the kits together so that everybody has what they need. So a little bit of where we're headed. We are looking to be a syringe disposal site at all of our locations, where we have a 24/7 lockbox outside so that people can come and dispose of their syringes whenever works for them. We also will accept syringes from anybody. You don't have to be an active IV drug user to bring your syringes in. You can be a diabetic. We've had people that drop them off after someone passed away who was on hospice. So we will accept them, and we also will give anybody sharps containers in return. So that's something that we are doing within the community as well. So like I said, you don't have to be a participant of our program to utilize some of the services that we have. Another thing that we're looking into doing is just another small step to help protect our environment and everybody who uses it is environmental cleanups. So we're looking at just going out in the community and picking up loose syringes, making sure they're taken care of and disposed of properly. And then we're also going to be partnering with CMU's mobile health clinic to offer mobile Narcan trainings and HIV and hepatitis C testing. So we're going to go out into the community, into those rural areas, to offer free Narcan training and overdose kits, and then offer HIV and hepatitis C testing as well. And to highlight some things that you can do, and we talked a lot about this last night. This was a big question that got brought up on the panel. But some simple things that you can do is just advocate, knowing your rights, being knowledgeable about what's in your community, and helping to reduce that stigma, having those conversations and being comfortable with them. And don't act like you don't know that you know everything. That's what I'm a firm believer in. I throw my newbie card out there all the time. I don't know everything, and I take pride in learning from my participants and building these relationships with people, because I can't serve someone if I don't know what they need. And if I act like I do, it's not going to get anybody anywhere. So I really, really encourage you to continue to educate yourself, continue to ask those questions. And when you leave here tonight, just tell one person about what you learned tonight. Just tell one person about, hey, have you heard of a syringe service program? Do you know what that is? And just talk about it, because there's some really cool things that we have going on in our state that really can help a lot of people. So I think I almost hit the 45-minute mark. So I'm going to stop sharing my screen, and I believe we're opening it up for questions. Um, One thing I do want to share real quick is my contact information. So you can call me on my extension at work. You can text my work cell phone that is confidential. I can barely get into it with my fingerprint alone, so it is completely confidential. We also use that number for our syringe service program as well. So people who need things, they can text me. I helped someone yesterday who had syringes and needed some, so they just texted me. I met them in our parking lot. They didn't even have to get out of their vehicle. So you can text me anytime. And then also my personal work email you can utilize. I always encourage students, if there are students in the audience tonight, if you have school projects or if you have presentations or anything like that that you need help with, feel free to reach out, and I can do the best that I can to help you. And if I don't have the answer to questions, I at least can probably navigate and find someone who can. So thank you, everybody.
Thank you so much, Shelby. What a wonderful presentation and so informative. At this time, if anybody has questions, please utilize the chat, and Shelby's happy to answer any questions that you have. It looks like we have one, Shelby. How has the ongoing pandemic affected the overall operations and outreach efforts?
Yeah, when it comes to outreach, I think that's the biggest impact that we've had, because we're used to, in health education and in public health, we're used to being able to go to health fairs. And so we had to get creative with how we're going to reach people during a pandemic when you can't see people. One thing that we did that I think was very successful through the warmer months that we're going to look into doing again is through those community drive through uh, the food distributions and things like that. We went and we handed out sharps containers and safe sex kits, and they had all of our information on them. So we got creative with that, and we are also starting to look into utilizing more of the online platform. And it's hard because we do serve a lot of rural areas, so we know that internet access isn't always great. So we have to kind of get creative in that sense. But I think what has worked best for us is having our promotional, like our stickers and things like that on our sharps containers and our condom packs that are going out to everybody throughout central Michigan. So I think that's kind of been the biggest thing, but it definitely has been a big barrier.
Thank you, Shelby. It looks like there's a follow-up question. I'm seeing you nodding your head. I'll let you read it.
Oh, I'm muted again. Fentanyl detecting test strips to patients that may be buying contaminated opioids illegally during lapses in prescription coverage. That's a great question. I can't speak for pharmacies themselves if they have that. I don't know honestly if they do. I know that we were able to get them through our program. That is something that I want to work with pharmacies, is having more of those conversations and making sure that they have resources like this. I do know a lot of pharmacies do offer naloxone along with their opioid prescriptions, but it does come at a cost. It's about $200 for one pack of Narcan. And what we're seeing is it's taking 2 to 3 doses of Narcan to reverse an overdose. So that's why we try to push our syringe service program and partnering with these pharmacies so that they don't have to have that additional cost to their patient, that we can help cover that. So that's something that we could definitely look into doing, is having, even a small little pack that says, hey, every time you prescribe an opioid, just have these little kits that you can provide through our syringe service program. But that's a great question. I'm not sure if they have test strips. When it comes to fentanyl, I don't know how often that is like written in. You guys are, I'm assuming most of you are pharmacy students, so you're going to know more of that, what's written in within that prescription.
Yeah, that's a great question, Elizabeth, and I don't have the answer to that either. I know I've never seen this done in a pharmacy, but I'm interested in that answer as well. So I'll certainly look into that and I can certainly get back to Elizabeth, but Shelby, I can follow up with you as well. Wonderful. Any last minute questions here before we close down and transition to the next sessions? Okay, so I'm not seeing any more comments here. However, if there are any follow-up questions, Shelby has put her email into the chat box, so you have her permission to reach out to her directly. Liz, great question. We are recording these and they will go on the CMREN YouTube channel. And so stay tuned for that. But certainly we're looking forward to sharing these, especially since there are co-occurring sessions and it's impossible to really hear everything all at one time. So thank you. It's a great point. Okay, wonderful. So at this time, I'm going to put the information on the screen for the next sessions. If you, let me put this up really quick here. So there's 2 sessions coming up and let me share my screen to make it a little bit cleaner. The one that is going to be occurring here in the same Zoom channel is going to be the Addiction is a Family Disease session. And then the other co-occurring session then is going to be Reversing the Stigma, Understanding the Importance of Naloxone Accessibility and Distribution. And so I've put the links to both of those in the chat. And if you want to stay with the one here for family, the addiction is a family problem, then certainly hang out here. If you are interested in the other one, please utilize that link. And then lastly, we do have a survey. We're very interested to hear about thoughts and comments about these presentations. And so if you have to leave us tonight at this point, here's the survey and the link. And if you will be hanging out for the next session, we'll post that again. So you can use that survey link after the final session tonight. So with that, I'm going to be removing everyone back to the waiting room while we transition into our next speaker. And then at 7 o'clock, we will open the room back up. So thank you all for attending. And thank you, Shelby, for a great presentation.